Hello and welcome back. I am Ashok Rajguru, your tutor, and in this video we shall be looking at support therapies which you can advise or teach your patients who are having a problem with urinary incontinence. Because our job does not end with just finding a remedy, and as Hahnemann has told us in aphorism 4 that a physician or homeopath is a sustainer of health. We must be able to help our patients to find relief not only through medications but also through advice on and guidance on lifestyle. So in this video we shall be taking a look at those ideas. The objective of this video presentation is we will be taking a look at non-medical interventions which have been found to help urinary incontinence. We will also see that as part of lifestyle guidance, we should be able to tell our patients how diet, drinks, and drugs, in other words, medication which they are taking for other conditions, are likely to impact their incontinence issues. Also, we'll be taking a very brief look at how yoga and Kegel exercises can help people to overcome this or at least manage urinary incontinence better. So first we'll take up drinks. What is to be remembered is that too much water or other fluids, and this appears to be quite obvious, tends to overfill the bladder. So you can always advise that your patients should limit their fluid or water intake to 2 liters, or in American terms 2 quarts a day. And in particular they should limit their evening intake, because the night time it becomes a very disturbing thing if they have to wake up frequently. It disturbs the sleep, they don't get adequate rest, and they run into other health problems because of lack of relaxation. Also, too little fluid should also be avoided because it irritates the bladder and promotes infection. So they should at least have a 1 liter or 1 quart a day. Alcoholic drinks are known to cause dehydration because they increase the urine output, and also they interfere with the brain's signals to the bladder. After all, alcohol acts upon the nervous system directly. So it is best to avoid or keep away from alcoholic drinks of any kind. Further, caffeine containing drinks like tea, coffee, all contain caffeine. Many soft drinks contain caffeine too, like colas, for instance. They are known to stimulate the bladder, and they also act as diuretics, which means they produce more urine. So they are likely to cause more discomfort, and they will be a sustaining cause to their condition, which is something that you should address and explain to your patients. Also, carbonated drinks like sodas or colas also irritate a sensitive bladder, and they are best avoided. So if you are having fizzy alcoholic drinks like champagne, that could be a very potent uh, drink which must be avoided at all costs. Going over to diet, acidic foods in general should be avoided. So that includes citrus fruits, tea, coffee, tomatoes, because they tend to irritate the bladder. So any kind of acidic food or sour fruits are likely to cause that problem. Spicy foods also irritate the bladder, and it is best to avoid that. Further, sugar, any kind of sugar, whether it's maple sugar, cane sugar, honey, and artificial sweeteners in particular, also irritate the bladder, so they should also be limited in their intake. Once again, carbonated drinks, because they contain some spices, they can contain artificial sweeteners, they must be avoided at all costs. This may appear to be a repetition, but all the same, it is something very important to be told to your patients. When we talk about drugs, we are talking about medication which the patient may be taking for other conditions. Most of the people who come to homeopaths are already under treatment of some form or the other from allopaths, and the common ones are listed over here. So we have high blood pressure drugs. Most of them are diuretics and they tend to increase urine output. Some of them tend to relax the bladder muscles, and that also allows the urine to escape under stress, which means while coughing or sneezing. Antidepressants and sedatives. It is advisable to tell your patients to consult their doctors who have prescribed these medications, because some of them hinder the ability of the bladder to contract, while some of them decrease the awareness to urinate because people are sedated. The same thing applies when it comes to muscle relaxants. Muscle relaxants have a very general action and they affect all muscles. So they are bound to affect the bladder muscles too. So please ask your patients what are the drugs that they are on and what are the actions they have on the bladder, and please send them back to the allopathic practitioners who have prescribed them so that he can take a second look at either cutting them down, eliminating them, or finding alternatives which will not aggravate their situation. Sleeping pills also decrease the awareness to urinate, and there could be a loss of urination during sleep or nocturia. And finally, smoking is the biggest enemy. All current smokers and even those who had previously been smokers, naturally it depends how many years they have been away from smoking, that helps. Another reason is smoking. Smokers also suffer from chronic cough, and that tends to affect the pelvic floor muscle tone. The pelvic floor muscles become loose and flabby, and that aggravates the problem because it affects the performance of the sphincters. Now we look at a few non-pharmacological therapies which have been found to be very useful. Some of them are related to understanding one's own behavior. So what is recommended by psychologists is, and you can read these recommendations in a journal article of the American Academy of Family Physicians, the AFP. You can find them on the website in the AFP journal, are lifestyle changes. So one is of course obesity. It has been found in a number of studies that if people lose weight and they exercise, uh, this particular activity is going to help their urinary incontinence for the better. There is moderate quality evidence, but there are no associated harms. So this is something wonderful which they can adopt in their lifestyle. Try to lose weight and do some exercise, even though there is not a very high quality evidence, but there are no associated harms. So good thing to try, which means there's a good likelihood it will help the person. Another thing is bladder training, which means they will have, and I will be speaking about it in the next slide. This is one way they can increase the time between their visits to the toilet for urination. There is low quality evidence indicating improvement. Now, when we talk about moderate quality, high quality, and low quality, it's just a statistical function. There is an arbitrary number which decides very arbitrarily what makes a study moderate quality or low quality or high quality. But the fact that it does have an impact is of importance to us, and it's quite likely that it will improve the condition of your patient. The last thing, of course, is the pelvic floor muscle training. There is very high quality evidence, and allopaths have been advised by the Academy of Family Physicians that this should be their first line of treatment. So you can recommend that to your patients, if unless of course they are having some physical disabilities and it makes it difficult for them to follow your advice. And it has been found to be 5 times more effective than no treatment at all. There are many studies which are available on the internet if you go to Google Scholar, and this is one piece of advice you can always give to your patients, or refer them to somebody who can give them or teach them those pelvic floor muscle training, and we shall be taking a brief look at them in the next few slides. When it comes to behavioral treatment plan, it centers around the fact that the person who is having urinary incontinence has to engage his mind along with his body, and in order to do so there has to be a level of awareness, and it has been found that that awareness can be enhanced if they keep a diary. They can keep track of the times that they go to urinate or leak during the day, and that itself can be a good guide to know whether any intervention is working or not. The next point that has been advised is that they should calculate on an average how many hours they had to wait between visits to the bathroom during the day. And once they know that, then the second step is that they will be choosing an interval on their own voluntarily and try to extend that interval of their visit to the bathroom. So you can advise them to set your starting interval for training so that it is, say, 15 minutes longer. Now again, there is no magic in the number 15 minutes. If the conditions do not allow, they can start at 5-minute improvement and gradually extend it further. But that awareness itself is going to help tremendously, because you see, our nervous system is very closely related to our mind, and the mind again is closely related to our level of awareness, and that part can be trained, and it's been found to be quite effective in a very large number of cases. So once they choose an interval, they can attempt to hold on that period a little longer to achieve the target time. So it's entirely in the hands of the patient how to go along these steps. It's entirely voluntary, and it has been found to be effective in a large number of cases. Next, we take a look at exercise. I'm certain most of you must have heard about the Kegel exercises, and they are supposed to strengthen the pelvic floor muscles. Now, the graphic that is now coming up is a very good illustration of the pelvic floor muscles and exactly where they are located. So on the left side of the diagram, which is the posterior side of the body, you have the sacrum, and in the front or the anterior part, visible on the right hand side of the graphic, is the pubic symphysis. And the two of them are actually the points between which we have the pelvic floor muscles. These are striated muscles, and they are innervated with somatic nerves. So these can be strengthened by exercise, and those exercises can benefit both men as well as women. There are many online resources available for guidance in different languages, and I will refer to them in the supplementary reading section in case you have any difficulty in locating them on the internet yourself. But before we leave this topic, we'll just take a further look at the Kegel exercises. So there is a contrarian view which explains why they may not be as effective unless they are supplemented with some other exercises which help to strengthen the gluteal muscles or the glutes. And here is how. This is how this is supposed to work. The Kegel exercises, as we saw in the previous diagram, help to strengthen the pelvic floor. Now this is the pubic bone shown in a schematic manner, and that is the sacrum, and this straight line shows a taut or a tight pelvic floor. It's supposed to be like a trampoline. However, if this muscle goes flabby and weak, it becomes, instead of a trampoline, it becomes more like a hammock, and it sags down. So once it sags down, the bladder also sags into it, and that tends to loosen the sphincter. So a person could lose urine while coughing or sneezing, that is stress incontinence. So that is one of the reasons why this exercise is supposed to work. So if we tighten that muscle, the sphincter should be more efficient. However, the next slide will show the limitations. So unless the Kegel exercises are supplemented with exercises which support and strengthen the glutes, Kegel exercises alone may not work, and here is how. As we saw, this is showing that straight line represents the trampoline-like pelvic floor muscle, and this blue line shows the orientation of the sacrum vis-a-vis the pubic bone if the person is standing vertically erect. Now, by exercising, these muscles become shortened and tighter, and the sacrum gets tucked forward, as is shown in this diagram, and the orientation changes. So the muscles haven't really become stronger. That is what this particular view says. And the sacrum instead has been pulled forwards, more towards the anterior side. And here is how it has been rotated. So instead of that, what is advised is to work on the glutes. Now, gluteal muscle tone matters, and how it can be helped is once again through exercises. The problem is that this entire area, whether it's the pelvic floor muscles or the glutes, they normally can tend to have a good tone if a person is having an exercise which works on these. For example, most parts of the world today, which we call civilized or which have been influenced by Western civilization, we sit on our toilets, and in fact that's a seat, instead of squatting on the floor. That is still very common in parts of Asia and in parts of Africa. Whether it's China, Japan, India, or many parts of Africa, people still have toilets in their homes where they can sit and squat rather than sit on a toilet seat. And even in America, there are companies which are making stools which will raise your legs so that you are quite closely following the squatting posture. Squatty Potty is one such thing available, which you can check on their website. But any other device which will raise your legs will help. So the graphic on the left is illustrating that particular point. So instead of squatting, we are sitting. That's a part of the lifestyle problem. The second point to consider is that the glutes are weakened due to lack of use. We tend to sit on softer sofas and couches. Our chairs are overstuffed, so the sacrum is tucked under rather than being pushed out. And there is hardly any exercise that is happening on these three sets of muscles, the medius, the maximus, and the minimus, which form the gluteal muscles, which support our buttocks. So you must have a regimen which includes exercises to strengthen that along with the Kegels. One way to find out if a person is having weak glutes is to notice how the person is standing and how the posture appears. So a pelvic tilt at the small of the back is the most telling sign that the pelvic floor is beginning to weaken. So in this diagram you can see that this entire pelvic orientation happens to be tilted, and that's very easy to detect if you see a person walking in to your office or if the person is standing. So that is one point you must keep in mind. Now we come to yoga, and there is a wonderful study done by the University of California, San Francisco Department of Medicine, and they found that after 6 weeks, the total frequency of incontinence decreased by an average of 66% from baseline in the yoga therapy group compared to only 13% in the control group. So that's a wonderful improvement, and that's a very encouraging result. Once again, I'm not talking about what yoga exercises were followed. You can find that on the internet for yourselves. Also, the same study found that stress incontinence, which means coughing, sneezing, and leaking, that frequency decreased by an average of 85% in the yoga therapy group compared to a mean increase of 25%. That means those who did yoga, they improved by 85%, while those who were in the control group and did not have the benefit of yoga actually suffered an increase of 25%. So that's a very encouraging thing to know. and you can always advise people to go to a yoga teacher rather than trying out something by looking at videos on the internet only, because yoga also needs to be uh, customized according to the person's age, state of health, gender, uh, and of course the stage of life. So all these things need to be considered before an appropriate yoga exercise package can be designed for the person. You will find some papers available in the supplementary resources section, and if you are interested, I would be happy if you can refer to them. To summarize what we saw in this video, first of all, we saw the effects of diet, drinks, and drugs. Diet can help a lot, and so can drinks. We saw that it is important to avoid fizzy drinks, carbonated drinks, colas, and alcohol, absolutely, because they all tend to increase the amount of urine output. And many drugs which people may be taking for their hypertension or other conditions can also have a direct impact. So best to ask them to consult their doctors if they can decrease them. And naturally, your remedies are going to help them in order to decrease their dependence on allopathic drugs. We also took a look at Kegel exercises and yoga. Kegel exercises, according to some experts, alone may not help, and you may need to supplement them with exercises which strengthen the glutes. And all these are an excellent adjunct for patient care. So please keep this in mind when you're helping your patients with your remedies. They will form part of your treatment. So that brings me to the end of this video. Thank you very much for your attention, and thank you, and bye bye.